Hi, it's Mark. I'm here in Vero Beach, Florida at the offices of Dr. Gerald Pierone. I have suffered from mild to moderate facial wasting, or lipodystrophy. Lipodystrophy is when you lose fat in your face, usually as a result of HIV medications. If you look at my earlier blogs, it's pretty obvious that I was suffering from some sort of lipoatrophy. But it's also true that I was an active drug user during a lot of that time. Beginning a few years ago, Dr. Gerald Pierone applied in my face a couple of temporary facial fillers known as Radius and Sculptra. And those were really good experiences. But because they leave your body after a while, they're eventually absorbed, I was looking for a more permanent solution. So in my last visit, Dr. Pierone applied Artefill, which is a more expensive but permanent facial filler for the treatment of facial wasting. Both Sculptra and Radius do have patients' assistance programs to make it easier for you to afford. Artefill, on the other hand, does not. I know this is about my vanity. I'm perfectly aware of that, as much as it is about correcting a physical manifestation of HIV medications. But look at it this way. You're the people that have to look at my face on these blogs, and I would like for it to be as pleasant an experience as possible. So let's take a look at what Dr. Pierone has in store for me today. Thanks a lot. I hope you don't mind needles.
We all have the same condition. It's called life. I'm living mine as a gay man and an addict in recovery who's dealing with aging and being a friend and finding happiness and staying healthy and having fun and enjoying laughter, all while living with HIV for more than 25 years. I'm Mark S. King, and this is my fabulous disease.
After that last treatment, how long would you say the effect lasted? When did you start noticing kind of a loss of the filler effect?
You know, I don't know that I have noticed much of a loss of the filler effect.
Okay, even though Artefill is a permanent filler, it really behaves more like a hybrid. So what we typically see with Artefill is you see the full effect immediately after injection, and then over the next 3 to 6 months, people lose a portion of that fill, partly because what's happening is a bovine collagen, the not permanent part of the Artefill, is being reabsorbed. You're putting your own collagen in place of it, but it's not a one-for-one substitution. So we typically do see a drop-off in the effect. You never go back to where you started, then we build on that base. It drops off a little bit, we build. So you eventually get to full correction after a number of series of treatments, but it's not, one treatment, it's permanent, I'll see you in 10 years. It is a series of treatments. A couple things, what I warned you about is sometimes when we build up in the cheek area, people will then notice the under eye hollowing, which was kind of camouflage because they just had loss of volume everywhere. So we'll definitely address that today with, in this area as well. Closer here today. But there is a little bit of a contour with that quote ridge, and we're going to smooth that in. So what we'll do is we'll feather in on the edge so that it's not as abrupt a drop off there.
What will happen to these? I know it's not an implant. I know it's something else in my cheek, but as gravity takes over, what will this look like?
It doesn't drop, as our face drops naturally. It's not like the PMMA drops more than your natural face would. So the short answer is it appears just like you're aging.
I'm excited about the correction under the eyes because of that hollow thing.
Yeah.
I will say that I'm one of those people that freaks out when things come close to my eye.
Okay, well,
so
we'll have you close
am I
your
going
eyes.
to feel needles wandering around under my eye?
No.
No?
Because again, we're using a micro cannula. We don't use needles anymore. And
micro cannula is the best invention known to man, because instead of him sticking me 20 times, he sticks once, and then this thing kind of travels under your skin, which might grow some of you out, but believe me, it's much better on the patient.
I would say we see 80% less bruising. It's much less painful. It's safer because we remove the rare but potentially catastrophic complication of injecting a filler into an artery or a vein. So for all those reasons, in my book, microcannulas are the way to be doing facial injections, period. Okay, so we're going to start. I'm going to put some numbing cream on the face, in the areas we're going to treat. Let that work for a minute or two while I prepare the Artefill, and then we'll get started. You're going to feel a stick. Stick. And that was a needle. And that will be the last time you'll feel that needle, because then we switch over to the micro cannula. And that's basically just to make a tiny little hole so I can get in and deliver the filler. There's actually lidocaine in the Artefill that comes from the factory, but we add a little bit extra, mainly to make the Artefill a little easier to inject through a micro cannula. You're doing great.
Am I?
Yeah. Okay. So Mark, on this side, we're pretty much done with the under eye area. I'm just going to finish up with a little bit down here.
I know that as an HIV activist, I shouldn't be ashamed of, and yet so many people feel that shame, that sense of judgment, and you know, the way that people speak to us as people who are HIV positive. So I can understand why people might want to wipe off the evidence,
Sure.
you know, of HIV. Do you see that a lot in your patients who are looking to do that? Do you think that there's an emotional component to this?
Absolutely, no question about it, because a lot of people, you know, even though we've come a long way in this world, there is a lot of stigma out there, and people go to work and they don't want to be targeted or viewed as someone with HIV based on their facial appearance.
Yeah.
Now, the caveat is, you know, that whenever we treat in this area, there's always some swelling that comes along with it.
Yes.
Product is there, but
Right.
and whenever we inject, there's always a little bit of puffiness, a little
Right.
bit of swelling just that comes up in addition. But I think you get the sense of where we went with this. And again, multi-step process, but where we're going is we're just going back towards what you would have looked like had it not been for the effects of HIV lipoatrophy.
So it's been a few months now since my last appointment, and here are the results. It has settled down, and I think that it's looking pretty good. I think I look like I would have had it not been for the facial wasting. A couple of things to keep in mind, though. Artefill, the permanent filler I now have in my face, is much more expensive, and they don't have the patient assistance programs. Remember that. So we're talking many thousands of dollars. If you go with the Sculptra or Radius, you'll get temporary results of anywhere from 6 months to 2 years or so. But those results will go away. But you're going to spend a lot less if you qualify for patient's assistance. And then secondly, make sure you pick your doctor carefully. Make sure this is somebody that has done a lot of these procedures. And by that I mean hundreds. Ask him. See how many he's done. See if he uses a micro cannula, because that's that device that avoids all those needle sticks and bruising and any possible complications from all of those needle sticks. Those are my 2 pieces of advice for you. Good luck. As always, thanks for watching, and please be well.